In a recent article published by Dr. Parvanian and Rugerbert in Inside Dentistry titled Turning Up the Heat, literally what they're doing is that they're just kind of doing a lit review on many articles published on the benefits of warming composites before your clinical applications. So this is my brand new Calset composite warmer. I've been using a Calset composite warmer in my clinical practice for over 10 years, but this is a new one that I just got for the office. And I just want to briefly share with you what this looks like. So you're normally going to get this base. This is the actual base that heats up all the way up to 150 Fahrenheit. And then you're going to get this multi-pro tray, which is a tray where you insert your composite. On the front aspect of the tray, you have 4 little receptacles for your composite compules. In the center, you have a receptacle for a compule in a gun, so that you can always have the gun handy with a heated compule right on the tip. And to the sides, you can actually place some composite syringes if you have syringes in your office. And on the back, you can put anesthetic, and also on the sides, you can warm up the tips of your composite instruments, which, like I said, all of these are extremely beneficial. When do I use warm composite? Well, literally, I do a lot of class 2 restorations in my office, and I use warm composite for every single one of them. Why? Because I feel that it's not only easier for you to extrude the composite out of the compule, but most importantly, the composite comes out in a more flowable state. So it will adapt much better, it will wet much better the walls of your preparation. And that in itself is going to create a very dense final restoration. And then secondly, I also use warm composite to sit my indirect ceramic restorations, like my onlays or inlays. And why do I do so? Because I feel that I'm going to get not only a better bond, but I have much more time to remove any excess, to work and make sure that my restoration is fully seated. And there's a lot of literature out there supporting the use of regular microhybrid composite for bonding of your indirect restorations. But you're not going to be able to do so if you don't warm up your composite, because as we all know, regular composite is very dense and it will be really hard for you to fully seat that restoration. So in these 2 clinical situations, I love using my Calset composite warmer.